Thank you. As you continue to do that, putting your name, your organization, and your state, territory, or tribe in the chat box, we'll go ahead and get started. I want to welcome you. I'm Patty Ryan. I'm the Training and Technical Assistance Manager with the National Center on Early Childhood Quality Assurance. For those of you who have joined us before, you know that primary focus of the National TA Center is on health, safety, and quality across all early childhood and out of school time program types. And we're particularly focused on supports that are important to family child care. So this is the fourth and final conversation that is focused on building strong systems of support for family child care, either to stem the decrease of family child care and or build the supply or even build back better after the pandemic. So I'm grateful to be here with our partners who I'll introduce in just a moment, and with my colleague, Sarah Kowiak, who I'll now turn it over to give you a few technical tips. Sarah?
Thank you, Patty. And so I just was going to go through, as Patty mentioned, a few Zoom tips before we get started. Everyone is joining the meeting today muted. And if you would like to join the conversation, you can click to raise your hand, and then one of the co-hosts will invite you to unmute yourself. You can also view and enter comments in the chat box by clicking the chat icon, which should be along your control panel and icons that you have. And this meeting is being recorded today. We also invite you to update your name within Zoom. If you could add your state, territory, or tribe, that will help us keep track of who's in the meeting and see who's participating with us. And then there is also the reactions button if you want to give us a thumbs up during the call today, share if there's something that you're really liking with the heart. And then within that reactions drop down is also where you'll find the raise your hand feature. And with that, I will pass it back to Patty.
Thanks, Sarah. And again, we want to welcome you to this conversation. If you haven't joined us before, really, these are meant for you to hear information, but also to ask questions, share strategies that you're doing, and really elicit feedback and comments from the audience. Sarah, if you want to move to the next slide, I'll just talk a little bit about what we're going to do today. First, I'll say that we're grateful for our partners both at All Our Kin, and I'll introduce Erica in just a second, and First Children's Finance, both of the organizations who partner with the Early Childhood Quality Assurance Center, really work so hard and diligently on behalf of family child care educators and really all of you who support family child care in your state. So to let you know a little bit about the flow of the day today, Sarah, if you want to move to there you go. Heidi Hagelbraid with First Children's Finance is going to share with them some strategies for financing systems of support, but she's going to focus both on system level financing as well as program level and share some key considerations for you. Periodically throughout the conversation, we are going to ask you some questions and hopefully elicit some responses for you. If you've joined us before, you know that we've in the past used Menti, which is a wonderful technology solution. We're going a little low tech today. We're going to have to just use the chat. So I do encourage you to type the answers to the questions and your own questions or thoughts in the chat as well. We're also going to make sure before you leave here today that you know where to find additional information and resources and support. And so with that, I do want to introduce Erica Phillips with All Our Kin. It's just been a pleasure over the last 4 conversations to work with Erica and get to know her. Erica is the Chief Impact Officer with All Our Kin. And with that, I'll turn it over to Erica. Erica?
Thank you, Patty. And on behalf of All Our Kin, we're really excited to partner on this series, supporting strategies for supporting family childcare. All Our Kin is a national organization that trains, supports, and sustains family childcare educators with direct service in Connecticut and New York. First, I'm going to share a graphic you may remember if you have attended any other webinars in this series. With the Collaborative for Family Childcare and All Our Kin's learnings from over 20 years of experience with family childcare educators, we distilled the core components of a strong system of support for family childcare. First, there must be clear standards and tools for accountability so that family childcare programs are supported in understanding and meeting health and safety regulations as well as early learning standards. The next component focuses on the quality of care so that family childcare programs have access to resources and support they need to deliver high quality care to children. Another component is support for strong business practices so that family childcare educators earn a living wage that supports their family, and they're able to run sustainable businesses that serve children and families for years to come. A plan must also include systemic supports so that family childcare programs are connected to each other and to stakeholders across systems that can offer tailored resources, information, and support. And finally, you'll see there are 2 components we've pulled out on top of the house, since they are critical to all components. Those are centering equity, and one you'll hear a lot more about today, ensuring sustainable financing. Those are both central to strategies to supporting family childcare. So today we're going to talk a lot more about family childcare financing, which can touch on many other components of the House framework. However, we wanted to emphasize that one individual strategy is not enough to support family childcare. Thank you, Patty.
Thank you so much, Erica. And in the previous conversations, we did talk about different services and strategies to implement, and always the question of how do you fund it, how do you finance it, et cetera, comes up. And like Erica talked about, there's not one strategy. Well, the focus on financing needs to be multifaceted. So there are really, as you're listening to Heidi and reflecting on today's conversation, there are really 5 key takeaways that we want you to go away with today. One is that financing is multi-level. Solutions should be multifaceted and address the multiple factors that impact the supply and sustainability of family child care. We know that in many states, territories, and tribes are focusing a decrease in family child care. And so again, there's not one solution, but the solution must be multifaceted. And the solution needs to be right-sized. Heidi's going to speak a little bit more about that, but throughout the 4 conversations that we've had, we've talked at great length about the unique needs and the unique characteristics of family child care educators and their businesses. Solutions need to be appropriate to that population and balanced. Investments and financing needs to be balanced across all provider types. Equitable, which, as Erica said, is really also a thread across everything that we've talked about. And really, Heidi's going to speak a little bit more about evaluating and then modifying policies and practices that have historically perpetuated systemic racism among family child care entrepreneurs. And last but not least, coordinated so that you can work across other agencies to make sure that family child care needs are met. And in particular, when CCDF funding hampers the ability that those constraints are addressed using other funding sources. So those are the 5 key takeaways: multi-level, right size, balanced, equitable, coordinated. There will not be a quiz afterwards, but as you're thinking about and reflecting about what you take away, those are the things that we'd like you to focus on. And with that, it's truly my pleasure to turn it over to Heidi Hagelbraid, who's the Chief Program Officer with First Children's Finance. So Heidi.
Thank you, Patty, and thank you for that wonderful welcome and setting the table for our conversation today. I'm just gonna, oh, here we go. Okay. I'm gonna walk through some slides today. Again, there is no quiz at the end, but I hope that you'll find some ideas that spark thinking for you today. And if there is anything that kind of captures your imagination or your attention, make a note of it. I'm always happy to follow up with folks afterwards if they have questions about a specific idea in practice somewhere in the country. So I thought first that I would just give you a little bit of a preview today of what I intend to talk about. And we're going to weave those 5 takeaways into the information. We'll talk a little bit about the ecosystem framework at First Children's Finance to help you understand systemic financing, some solutions, and it's going to guide our conversation. And then we're going to talk about how do we take that ecosystem, which is a very high level thinking, and how do we bring that down to the ground to create financing solutions on the ground for family childcare businesses. A couple of things just before we get started. All our kin, thank you for being here. They use the word educator quite frequently. I'm going to refer to as family child care providers as entrepreneurs today. And so when I say entrepreneurs, I might use those terms, family child care and entrepreneurs intermittently. I'm talking about the same folks. So if I start calling people entrepreneurs, please know that I am speaking particularly about family child care business owners today. So first, it might be helpful to know a little bit about our organization. Who in the heck is First Children's Finance? Why are we here talking about financing with you today? There might be a couple of hints in the names. We are a national nonprofit. We are headquartered in Minneapolis, Minnesota. I am in my office for the first time in like 18 months. I'm on day 2. So if you see any changes in lighting behind me, if I don't move for a while, the lights turn off. So if you see it get really bright or really dark, that's what's happening. We are a CDFI. That is a community development financial institution. It is a distinction given to us by the U.S. Department of Treasury. CDFIs exist all over the country, and we are one that is dedicated only to child care financing. We have been around for more than 30 years, and we, to our knowledge, are the only national organization focused exclusively on the supply and sustainability of child care businesses. That is the crux of our work. We work in about 20 different states currently and are facing increased demand. As you can imagine, as you are working in your state to figure out how CARES, CRSA, ARPA, and any other sort of things are rolling out across your state, we are engaged in a lot of conversations across the country, and I'm happy to bring that unique perspective to our conversation today. I am going to skip this last bullet point because I'm really actually going to tell you a little bit about our theory of change and the 3 different parts of our work so that you'll understand the difference between systemic financing and financing at the program or business level. So we work in 3 different areas, and the first area of our work in service to our mission is partnering directly with childcare businesses. This is about building their capacity to do this work well. We do a lot of training, consultation, coaching, and technical assistance. This is also where our lending activity happens. So we provide access to capital to family child care providers in 11 different states, and that is growing. So if we aren't lending in your state, we may soon. The second part of our work is partnering directly with communities, everything from very rural to urban and population centers in between. They have unique and distinct needs, and we help communities to think about how to sustain the supply of childcare that is needed for a healthy and vibrant community and a strong regional economy. And as you can imagine, family childcare and childcare in general is an important part of the picture of that health and vitality of a community. And it is why we focus part of our work in building childcare supply and the sustaining of that supply. And then finally, we work with public systems, both state and federal, territorial, and tribal, working to help them understand the business needs and the finance needs of childcare businesses through advocacy and expertise, elevating and advocating for childcare business practices and financing and policies, and thinking about how to be innovative to respond to the need that evolves as family childcare shifts and changes. All of those things together really represent our theory of change. And those nice, bright, clean circles with strong edges look great on a piece of paper or in a PowerPoint presentation. But in fact, those things are very messy, interconnected, tangled together. There's not really a clean distinction between all three of those levels. And it really is why we work across the entire spectrum of childcare in all of those different ways to be able to fully understand the key performance indicators of family childcare on the ground, to be able to advocate for strong policies, funding mechanisms, and programmatic interventions that make a difference in state, federal, tribal, and territorial government. So I think in addition to sort of talking about the use of the word entrepreneur, you should note that I'm going to talk about things from a very different perspective. There will not be a lot of pedagogical conversation today. What I'm going to talk a lot about today is really business, accounting, finance language, and we're going to start with a clear definition about financing. And I think it's helpful to guide the conversation to really draw a distinction between what different kinds of financing is and how it operates. So we're going to talk about today two different kinds of financing. One is system level financing, the other is business level financing. System level financing is policy. It is the money and the dollars that come through a public system like the CCDBG, which results in CCDF funding. It is the administrative decisions that are focused on addressing family childcare in a state, a territory, or a tribe. That is a really big bucket of things. That's where we're going to start our conversation today. And we're going to draw down eventually to the business level financing. And this is probably something that we're a little bit more familiar with. If you purchased a car or if you financed a large purchase, maybe a home or some sort of long-term debt, financing is something that you've encountered in your life. Maybe it's that student loan. It is capital, meaning money. So I'm going to use the word capital today a lot. Capital really just means money to finance an individual family childcare business. These two things, as you can imagine, and as I refer back to our theory of change, are really closely connected. And so making sure that we are clear about how system level financing impacts business level financing and vice versa is an important thing that I hope will be a little clearer for you at the end of our time together. I'm going to introduce you first to what we refer to as the childcare business ecosystem. This is something that First Children's Finance has built out due to our work in multiple areas over 30 years. It looks a little bit like the periodic table, and in fact, we refer to each one of these green squares as an essential element. And it can be used in multiple ways, but it really does represent what the child care ecosystem is. And If you know anything about system financing for childcare in general, you know that there's really not a systemic approach. There is not a system for childcare in the same way that there is a system for K through 12 education. And as you follow the trail of where childcare money lives in your state, sometimes it may be in a Department of Human Service, sometimes it may be in a Department of Education, parts of it might be over in the Department of Health, part of it might be over in workforce, part of it could be in commerce, labor and industry, really is scattered. And one of my good colleagues refers to it as a shard of system, that it is really spread out all across government. And so the ecosystem really represents First Children's Finance's organizing thought about what the business and finance parts of the childcare system include. Now, I love a good home visiting program and I love infant mental health, but that is not the focus of FCF's mission and work. And so you will not see the entire universe of early childhood or childcare represented here. The limitation of this document and of this framework is really that it is the childcare business ecosystem framework. And so you will not find this as a universal tool across the entire spectrum of early childhood. This is specifically about business and finance aspects of childcare. States, territories, and tribes can use this as an effective assessment tool, as a planning tool, and it is in use by a project that we call the ECE Business Collaboratory. That is a state level intervention that includes, I think now, 14 or 15 different states. So I'm gonna walk through that, but the copy that I just had was a little small, so we're gonna see a bigger version in the middle after this slide. But what I think is helpful to know and to center your understanding of the ecosystem is that often in state government, in tribal government, in territorial government, as we are striving to make a difference, we may focus our efforts on a couple of different things. And what the ecosystem framework does is bring equity to all of those different elements and understanding that all of them are essential. And some of them become priorities when dealing with a particular set of characteristics in your local government or in a particular situation. And I'm going to talk about that as we go through the ecosystem in a moment. What it does encourage you to do is to have a balanced and intentional approach, that you are thinking broadly, intentionally, and across multiple different priorities to think about how to address the need for family childcare in a balanced and intentional way. We sometimes can be drawn into what sounds like a really innovative idea. And so the ecosystem helps you to avoid a silver bullet phenomenon. We sometimes latch on to the thing that we understand least, and we think, oh gosh, that sounds exciting. I've never heard of that before. That seems like it might solve the issue. And we can sort of swing wildly from this one silver bullet to another. What I really want to share with you today is to help you think about a way in which to be balanced, intentional, and create a suite of coordinated strategies to really address the needs. Because just like children, not all family child care businesses need the same thing and are not all in the same kind of place with the life cycle of their business. And so if you're going to build a systemic level of supports, you really have to have a balanced, intentional, and broad approach to make sure that you're capturing all of the available innovations that you can pull down for replication in your state. I also want to talk about just this idea of a multi-level approach. Just like First Children's Finance, we work in 3 distinct areas: individual childcare businesses, communities, and systems. I would encourage you to think about policy, administrative decisions, and funding through a multi-level approach. You need to build your system of government, and you have needs to be able to deploy all of this work. So there are systemic needs, There are systemic needs that are across the environment of family childcare businesses. And you're going to need strategies that impact communities, and you're going to need strategies that impact individual family childcare entrepreneurs. So really thinking about all different levels of support is important, and making sure that you are building a systemic approach as you are thinking about that broadest and highest level of support. So let's think about and talk through what these essential elements are. And I'm just going to walk through each one of them, give you a brief description, and we're not going to dive into family childcare right away because I want you to sort of get a sense of what these things are. And we are later going to show how you can apply the lens of family childcare perspective to the ecosystem. Some of these are going to be very easy to understand. So we're going to start first with workforce. Everything that has to do with the workforce, including preparatory programs to compensation, to teach, retain, any of the professional development or requirements and the needs of our workforce in childcare is all held there. When we work with states specifically, this is a very hot button issue for many of the folks who are on the call today. Workforce is a blanket term, and there's a lot held inside of that. Just because it's called workforce and it's got one square does not diminish the amount of things that are held there. It is deep and it is wide, but it is not the only thing. And so you'll start to see here why it's important to really think about an entire ecosystem of factors. Business efficiency is simply a shorthand for anything that is centralized efficiency. That might be shared services, that could be your family childcare network. This is anywhere where you are centralizing services. Perhaps it's a hub model that has a quasi-governmental feel to it. However, you're trying to get to economies of scale, that is what business efficiency is. The third essential element on that top row is training and education. That could be anything from articulation agreements across higher education institutions to the licensing requirements that are required of a provider, to the ongoing professional development of the QRIS system, or simply the licensing system. The fourth bullet point is really, again, remember this is the framework of business and finance. Consultation, we believe, is the key element that has to be part of your system. That training and education does not address that need alone. There is the need for consultation to be able to address the very tricky business model that is childcare, and the even trickier model, which is family childcare. Moving to the second row, we talked about this a little bit in our definitions about what capital and financing is. Access to capital is an important thing, and we pull that apart from other parts that seem similar. Access to capital is the money. It's the dollars that you spend to be able to start up, operate, invest in quality, or grow a childcare business. Subsidy, of course, is the reimbursement provided to childcare businesses to serve low and moderate income families in different states, tribes, and territories. You may be subsidizing different things. So it is not just childcare subsidy, but any payments that are coming and are subsidizing the ongoing cost of providing care. Supply building is a distinct and specific activity about increasing the net number of slots in your state, territory, or tribe. It includes connections to access to capital or to facilities or to workforce. Those things are connected, but separate and different enough to be able to be worthy of their own essential element. Facilities planning is the bricks and mortar, the facilities, the walls and roof that house programs of all different types and sizes. System reform pretty straightforward concept here, but what are the changes that need to be made to policy, to legislation, to statute, to practices, to funding streams that allow us to do this work more effectively? And then system financing is slightly different. System financing is having enough dollars from enough places to be able to fund the system that needs to be there. System financing may be using the existing resources from the federal and state government, county, wherever you are situated, to be able to fully deploy support to family child care providers. It may also include identifying the need for more and different dollars and how to guess at, to predict or project how much of the funding that you would need to have to build the system that you truly need to benefit child care providers in your state, territory, or tribe. And then finally, public-private partnerships. And that is simply bringing together the resources of the public government, whether that is state or federal, and blending it with different kinds of money, private money that may be coming from philanthropy, from corporations, that is not public tax dollar money, that has different flexibility. It can do different things, and blending those two sources of funding and resources, not just dollars, but resources as well, really can help states, territories, and tribes to think about how to solve some of the challenges that they have inside of their own systems. So you may be wondering, okay, we just went through all of those things. I'm not exactly seeing how it fits to family child care. And if that is the case, I thought it would take just a moment to sort of highlight where family child care lives in the ecosystem. It isn't a call out. And as we were designing the ecosystem, we talked to lots of our national colleagues, national thought leaders, people from all across the country in the design of the ecosystem. And one of the things that people said was, oh, I don't see family child care there. And family child care is incumbent. It is inherent. We don't call it out explicitly because it is part of the delivery mechanism that is absolutely essential in this country, in every community. And so we think that it's important just to maybe highlight where those live, but there's a reason it isn't called out specifically, because we're talking about universality here. Family child care is in the ecosystem. The ecosystem is addressing family child care. So when we look at the ecosystem again, it may be helpful to have some examples of where family child care lives and breathes inside of the ecosystem. So let's talk about supply building. Patty talked about it in her initial remarks, and this is session 4 of 3 really powerful conversations that have been addressing the lack of new family child care providers, entrepreneurs, educators coming into our field. We seem to have a shrinking base of those folks. So a lot of states, territories, and tribes are saying we need more family child care, and we need culturally and linguistically relevant family child care. We need more of it. And so supply building has everything to do with starting up brand new family child care businesses, looking for those entrepreneurs and helping them to be able to navigate licensing, the regulations, the requirements of professional development or education, all of those things in a coordinated initiative to build the supply that is desperately needed in so many places. But if we just move to the left, part of why we lose folks from family child care is they can't make the dollars and cents work, that they love the work, are drawn to it for all the right reasons, but they also have to make the mortgage payment and be able to achieve their own dreams for their own family. And so subsidy, if we just move one square backwards, is a big part of family child care. In this work, I've been at First Children's Finance for 9 years. Family child care rates of tuition are always very close to subsidy rates. And so for good or for bad, we can debate that reason for a long time, but subsidy has this influence on family child care pricing, whether we like it or not, it is a factor. And so the rates of reimbursement for children attending family child care have a lot to do with the business sustainability of those family childcare entrepreneurs. We move one more square over and we talk about access to capital. Many of the places where family childcare is happening are in people's privately owned homes, and access to capital is desperately needed when the furnace goes out in a cold state in January, or the air conditioning goes out in a really hot state in July. Access to capital is what's needed when a hurricane blows through town and the roof isn't on the building anymore. Access to capital is absolutely necessary for those programs who, in order to stay as a family childcare entrepreneur, want to carve out specific space in their homes that doesn't have to be shared by their family. They can sort of close a door and have a psychological break from the childcare business at the end of the day. Access to capital has a lot to do with that. Access to capital is really important for family childcare providers because they are largely women, and many of them are women of color who struggle to get equitable access to capital to start, to improve, or to grow or invest in the quality of their businesses. And so making sure that we are providing access to capital using our state, territorial, and tribal resources is absolutely critical. So hopefully that gives you a sense and a flavor of how family childcare can be found in the ecosystem. This is not our ending point, but I'm going to pause here. And Patty, let's ask our first question.
Okay, that's great. Heidi, I wasn't sure if you wanted to ask the question about overcoming the barriers and or the primary sources of funding.
Let's ask the question that is, let's ask the barriers question.
Okay, one of the things that we're wondering is if your state, territory, or tribe has actually researched what new entrepreneurs may need to overcome barriers to starting either licensed, regulated, or in some way getting into the more formal family child care business. So if you would just use the chat and type in the chat if you have done research around that. And Heidi, as people are thinking, maybe you can just talk about a few of the solutions that you've seen so people get an idea of the kinds of things we're thinking about.
Yeah, thanks, Patty. So as you contemplate that question, I think it's always helpful to sort of hear what other people are realizing. And as we work with the ecosystem framework and we ask states, territories, and tribes to sort of identify where their initiatives lie, sometimes they end up realizing that they unintentionally have made a lot of decisions that are just in one bucket. Like they might only really have funded the training and education bucket. They've got a lot of different things happening, but they have many different things that are just occurring in one spot. They might be geographically diverse. They might have a lot of them, but they are really only in one essential element area. So some of the things that I think are really interesting is when states, territories, and tribes really do start to think about the different ways that they can invest. And I, in particular, will call out a couple of tribal communities who realize that they don't have enough linguistically relevant care or culturally relevant care, meaning that they are really concerned and really want to prioritize language preservation and childcare, making sure that families have access to the quality care that they need to be ready for kindergarten and beyond. And so some tribes are realizing that they have really robust Head Start programs, but they don't necessarily have a non-traditional hour care. And that often will happen in a family child care setting. And part of what they're thinking about is not only do they want to talk about supply building, they need to talk about access to capital They also need to talk about facilities, because housing may be a giant barrier to creating more culturally and linguistically relevant care in a tribal community. So thinking about what assets they have available and spreading those out is a really important concept. Another thing that I'll point to is public-private partnerships, where small and medium-sized businesses have said, we can't build like a giant childcare center, and actually we're an employer in a rural community, and we need some slots, but not hundreds of slots. And public-private partnerships have been a really great way to incentivize the creation of family childcare businesses in communities where perhaps private dollars that do not have the limitations of CCDF dollars could be used for construction, for major renovation, or facilities needs that maybe public financing is not available for. There's all kinds of really interesting things happening. I'm just going to look at our chat.
Thanks, Heidi. There's not a lot in the chat because for a variety of reasons, I'm sure. I did put the question in there, but I wonder if Erica might unmute herself. And I just want to ask Erica, in terms of what you're seeing in your work with states, territories, and tribes, both in the identification of barriers, but also in the what works, what are some key considerations that you have? I know we've talked about a few, but just wonder if you might want to bring them up.
Patty, I think that is a great question, and certainly something that communities are thinking throughout. One of the most important things that we're seeing and we're encouraging is to make sure that there are consistent ways to have feedback from educators about what they need, and really just ensuring they have a good understanding of what's needed for their survival and really thriving, and to ask them to do that. Certainly through surveys, but also through, we see advisory panels, through some of the systems we've talked about earlier. So family childcare networks, CCR&Rs are also great ways to collect information, not only about what is provided, but also how do they access it. So something that we're seeing is some of the resources that are being provided have been burdensome, at least in the eyes of family child care educators, who have full-time businesses and programs on their own. So also getting feedback not only on the substance of what's provided, but also is it make sure it's not burdensome to them, or there could be other reasons holding them back from accessing those resources.
Great. Thanks, Erica. And it really is, Heidi, in the other three presentations, we've really talked about the importance of asking the providers what's hindering them and what they need to help, and making sure that there are solutions. And I think that ties just nicely into everything you were talking about, specifically creating the right size solutions. So thanks, Erica, for jumping in.
Thanks, Erica, and thanks, Patty. I think maybe the response to the poll is maybe people aren't asking, or they haven't done the research. And so that's a really good point to take away from this conversation, is making sure that you know what they need, what they are looking for, and what are the factors actually that you are dealing with in family childcare. So often we hear stories of the supply of family childcare is going down, and we're not, people blame it sometimes on regulation, or they'll blame it on a couple of things. And actually, when you dig into the data, in one state in particular, they weren't losing people. The attrition rates stayed steady for many, many years. But what they weren't doing was backfilling new providers into the licensing system. They were not gaining the same amount of folks. They weren't losing them any faster, but they weren't attracting people into our field in the same way that they had done earlier in the time period. And so if you are unsure of where to start, that's a good place to start, is start to research what you're already doing, plan it. This is, if you remember, this is an assessment tool, sort of plot it out and where you think it belongs, where the strategy lives, and then figure out how to move from there to a more robust strategy that may be broader in its reach or deeper. It may need more money, it may need more reach, or it may need to be more available at scale inside of your state, territory, or tribe. I'm going to move our slide here. You all work with many, many bosses, right? You are part of a system. And as much as we like to think that we can make a difference, there are other priorities that we have to balance. And so what I like about the ecosystems design is that it holds space for a lot of priorities. And holding space is a great nonprofit term that means you can bring other things into the fold under the alignment of the ecosystem. Let's say that you have stated priorities already. Let's say that your state, territory, or tribe has said, we need X by this time. You may have some stated priorities that you have to work within the parameters of meeting that goal. You may have a governor or a legislature or a governance structure. Perhaps you have a children's cabinet that has a particular vision. It probably has a beautiful strategic plan that's multi-year and it's somewhere on a website. You may also need to align the ecosystem there. And so I think it's just important to note that it doesn't have to be one or the other. You can hold a lot of things, even when they don't feel like they match up, really thinking about how to hold those things together. And then finally, you may have a specific challenge. Maybe it is unstated, but perhaps you know that your state, your territory, or your tribe is really struggling with a particular thing. You are going to know it best. And I know that I receive a lot of questions about linguistically relevant family child care, culturally relevant family child care, the amount of family child care, whatever that challenge is, that also can be held within the ecosystem. So it is flexible enough to hold a lot of things and can be a really great guide for you to think about your systemic investments and the financing, those public dollars. How do you build robust support? And I think as long as you have an intentional and balanced approach, you can do a lot of things well. And having that roadmap of the essential elements can help you to make sure that you aren't distracted by a shiny, promising object, and that you are really covering all the bases of what family child care entrepreneurs need. When we talk about financing, sometimes it's the money we have, and sometimes it is the money that the system wants to have. Maybe it is a policy, it is a legislative ask, it is an increase in funding at a different level. But as you examine your system for financing opportunities, I want to encourage you to think deeply about ways in which you can address equity through innovative solutions. So this means that you're really going to have to take an idea and examine it from multiple angles and really make sure that you are not perpetuating a systemic challenge by your new next brilliant idea. And when I think about this in family child care, it raises some flags for me right away. And I think lots of folks are on a journey to thinking about how to create a more equitable system at the same time that they're trying to actually build a real system. But family child care has connected to it some equity issues that you could, in your innovation financing, look to resolve. And so I'm going to point them out to you and hope that you will think about ways in which you can intersect some of these things. And the first one I want to talk about is home ownership. And I am a proud parent of a millennial who does not own a home. And if she decided to get into the business of family childcare, she would immediately encounter some obstacles in setting up what is arguably one of the easiest businesses to create. Family childcare in many states, territories, and tribes can only happen in a home. And as we think about access to capital and we think about who owns homes, that complicates the conversation as we think about equity for family childcare providers. And so looking for innovations and ways in which it might not be the financing of startup, but maybe licensing. How can you create flexibility while maintaining health and safety standards that allow family childcare to happen in places where home ownership is not necessarily a requirement? I'm going to point out one other thing. Background check challenges. Who I share my home with means they are part of background checks for my family childcare business. And because of who is in my family, I may also not be able to be qualified as a family childcare provider because I have someone who lives in my home who can't pass a background check. That is where home ownership or alternative facilities become a very viable option to think about, because there are all kinds of family dynamics and situations, but what you are thinking about right off the bat is home ownership, and also coupling it with increased rates of incarceration or increased rates of conviction of crimes makes certain populations of our communities unable to provide family childcare. And so thinking about ways in which we can address some of those barriers in our innovation financing is really important. The third point I want to bring out is the physical location of family childcare and the neighborhood it lives in, the community where it will be housed. And there are parts of town where capital and access to capital are much harder to get because of redlining practices. There are all kinds of things that feed into that issue. So as you're thinking about financing structures and trying to address equity, these are important considerations to keep in mind. And then finally, so this is not necessarily an equity issue, but I think is important to note nonetheless, is that the scale of family childcare may be impacted and its existence or sustainability may be impacted by local code or local regulations that really don't have any bearing on family childcare. Family childcare is not serving like hundreds of children in a very tiny home. Like, that's just not the thing. But if local regulations prohibit family childcare, even if you have a state that allows you to have a license for 12, but the local codes and regulations decrease it to 6, it's really hard to build a sustainable business model based on enrollment of 6 children only. So anywhere where there are HOAs or local regulations regarding the size of family childcare, these are places where you can make a difference that may impact supply. So just something to sort of be aware of as you're thinking about financing the new and inventive ideas. How will you also make sure you're not perpetuating barriers and solving for some of the equity issues?
And Heidi, I want to stop you there. Valerie actually had a question about the work that you're doing with states around recruiting new family child care providers to increase the supply. And while I know we're not focused on strategies necessarily to recruit new providers, can you just tie in a little bit about what you talked about and your approach with the states that you're working with, and how I'm sure other states, territories, and tribes are thinking about making those kinds of investments?
Sure. That's a great question. Thank you for asking that question, Valerie. So we work in a couple of different ways with states, territories, and tribes. Number one, we have First Children's Finance offices in the upper Midwest. So if you're in Michigan, Minnesota, or Iowa and connected states, often you will find us there. We provide lending services and capital to childcare businesses in 11 states. And then we have national scope projects as well. So we have ECE Business Collaboratory, where there are 14 or 15 states in that. And those states are listed on our website, where we do consultation work is also a part of why I think Patty invited us to this conversation, is that we work with all kinds of different state governments to build strategic systemic plans, and then the delivery of those plans directly to folks on the ground. So I'm not sure if I missed anything, Patty, that you were hoping I was going to highlight.
Well, I think it speaks to something that you often talk about, not just right size solution for family childcare, but implementing right size solutions for states, territories, and tribes and their communities too. So thanks, Heidi.
Yeah.
And Valerie, if you want to follow up, just go ahead and put it in the chat.
Yeah, I neglected to mention our tribal work. So we have a partnership with a firm called Indigenous Visioning. It's called the First Children, First Nations Child Care Collaborative. And that is a specific initiative to build the supply of culturally and linguistically available care in tribal communities. So both on tribal land and in tribal communities that may not be on tribal land. So there's a variety of ways in which we work with both systems, with communities, and with individual childcare businesses. But we do a lot of supply building around rural communities as well. There are unique challenges on both ends of the spectrum, both rural and urban. And we have a lot of initiatives across our organization that are focused on building supply in both of those settings. And then, of course, everything in between. But a lot of our community work is based on empowering communities to build the environment they need to be supportive and hospitable to childcare businesses, and to create supports at a local level. It's not any different than maybe what's happening at a state level, except that they're blending federal, state, and potentially city, municipality, or county dollars to the mix in order to spur that innovation to create more family childcare entrepreneurs. Okay, I'm going to switch over to our next slide here. What I want to do next is draw the connection between systemic investments and systemic financing, and then the business financing strategies. And it might have been what you thought at first, and our work as a lender might be what cuts to your mind right away. But I think let's draw the connection between them. And the best way to do that is to look at a financial statement of what family childcare looks like. So this is a very simplified version of a financial statement. And what you're seeing here are just categories for the income portion of that statement. So if you refer to it as a statement of activities, this would be the income statement. If you refer to it as a profit and loss statement, this would be the profit part of it. And what these categories reflect are the different sources of income that most often come into family childcare. This is not an inclusive list, because I know right away you're going to be like, but we have early learning scholarships and we have blah, 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 blah. These are broad categories. And so you're going to want to think about what income family childcare providers might be receiving in your local area. But often the largest bucket comes in the form of tuition. And that might be anything from private pay to subsidy to a sponsorship, a contracted slot. However money is coming in to a family childcare business for their service, that's reflected in their tuition. The next bucket is CACFP. If you're not familiar with that acronym, that's the Child and Adult Care Food Program. It is a really important part of reimbursement inside of family childcare businesses. On average, at First Children's Finance, if we when we look at the aggregated information of our family childcare clients, it makes up 10% of their income comes in from that line item. They may also have income from fees. They may have a registration fee, an annual fee, an assessment fee, a field trip fee, whatever those fees are. There's another source of income. Quality initiatives may be financial incentives from your quality rating and improvement system. Perhaps you have a county level intervention where you require folks to have a lower ratio, and as such, you give them a certain amount of money each month. And then just a broad line item to capture any other income. So now let's make the connection between how money comes into a family childcare business, and let's make a connection to where there are system investments. So here's some examples, and I encourage you, if you think of others, type them right into the chat. So the way that the system does financing at an individual business level is subsidy payments. It might be tiered reimbursement payments. They might pick up the tab on enrollment fees or an annual fee or some sort of reimbursement system. If there are others, please feel free to drop them into the chat. So we have all these big system investments, and largely they hit the bottom line of family childcare businesses in the form of subsidy and reimbursement for childcare services. Okay, so now let's look at the expense side of the house. Again, this is a very simplified version, but these are largely what family childcare businesses spend their money on, okay? So occupancy, if that is a portion of their home's rent or mortgage, a portion of their home's utility bill, cable, phone, any of those sorts of things that are reflected in the physical space where the program is operating. Insurance, the homeowner's insurance, the property insurance is held in the occupancy line item, but often family childcare providers are carrying some other type of insurance. It may be that they have a child abuse and molestation policy that they carry on their business. It may be a child care specific policy that they hold. There are insurance things that they carry because of the family child care business that they would not have because of their home. They also spend money on legal and professional services. This may be an accountant, a bookkeeper, a tax preparer, it may be an attorney, anyone who is providing professional services in a business capacity often are reflected in this line item. Transportation. Family child care providers may be, number one, transporting children and having some costs associated with that, or two, they are doing transportation themselves as they operate the business. They may travel to some trainings or to a conference. They may travel to go purchase supplies or refill the supply of 2% milk that they need in their refrigerators. Program operations are reflective of all of the consumable materials that we use inside of family childcare. It is all of the learning materials, the curriculum, the assessment, all that kind of stuff, all within program operations. Where I would call out quality initiatives are expenditures made specifically due to meeting an accreditation process or to a quality rating and improvement system. So if you want a 5-star rating from your QRIS system and it requires you to go to an 8-hour training on the curriculum that you chose, that would be something that you would sort of capture in those quality initiative expenditures. And then finally, personnel. Any of the people who are paid by the family child care business to be in employment situations. So any of the folks who may be a helper or a substitute, largely any of their wages and compensation would be held in personnel. So now let's draw the connection between system financing and business level. Here are some of the things that we know states, territories, and tribes may be contributing to. Oh, I gotta find the right clicker here. This is the most popular category. We love a brand new crib. We love a set of books. That baby doll group of that is reflective of many different cultures. We love being able to buy supplies and materials, particularly for folks in our QRIS system. In the early days of QRIS, that was a lot of what the expenditures were. And it continues to be a concrete, definitive thing that people need, and it can be helpful to programs. Next, we are really comfortable with paying for curriculum and assessment, and maybe even the training attached to those. Often states have negotiated rates for approved programs, curriculums, assessment systems from a variety of different vendors. And that's something that, again, we pay for or subsidize inside of quality and rating improvement systems all the time. We also do a lot of underwriting of professional development. We have registries, we have approved trainers, we have approved curriculums. We may have contracts with CCR&Rs to provide a certain amount of training. We may have chosen different kinds of training to be available to the providers in our state, and they are subsidized at a particular rate. Professional development is also something that we are really comfortable paying for. But I want you to think about what's missing. So we have, I'm just going to back this up really quick here. Let me go back to the ecosystem. I'm just going to show you. These are a whole bunch of things, right, that a system can be providing that is needed to have the robust system of family child care that you need in your state. The things that we just paid for largely aren't reflected here. And so this is what's so powerful about the ecosystem is when you make those connections, sorry for the jumping of slides here, but when you're making connections to what investments are you making that are actually hitting the bottom line of family child care businesses, it's a pretty quick exercise. And I would encourage you to do it. So what are the things that are missing? If you can think of any, throw them in the chat. Couple of things come to mind to me right away. We saw no long-term debt here in any of these things. So yes, we have occupancy, but what if our family child care provider lost the roof off of her house and she has to pay out of pocket? That's not reflected in any of our investments in our state. Maybe your state does, but largely that's not part of what's happening here. Is we are not really financing the homes in which these critical operations are operating. The other thing that you don't see is health insurance. We saw personnel, but although if I was looking at like a corporation's expense statement, that personnel line item would have a whole bunch of things. In family child care, it is often payroll and payroll taxes and not much else. So what we don't see are any health insurance, any benefits, any paid time off, or any retirement. We rely on the family child care providers using their income to fund those things on their own. And one other thing that I would just say is we don't really address compensation at all with family child care. It is a mighty struggle for system folks and in states, territories, and tribes to talk about compensation of family child care providers in an equitable way, that they talk about it inside of child care centers or programs where there are staff. And so what we really need to make sure is that as we think about what family child care providers need, why we're losing them, or why we're not attracting folks into our field. These are some of the things that we have to think about. It's a really quick exercise to just say, well, let's incentivize some things, but we really have to make sure that those incentives come down to the bottom line of family child care in a business level financing structure. So as you think about business financing, what can your system do? I want to challenge you to think innovatively about how you can impact the sustainability of existing programs and also address the need for more family child care providers through business financing. So number one, here are just some ideas, and a good starting place is rethink workforce compensation initiatives to be inclusive of family child care. So if you are so lucky to be in the seat of decision-making inside of your territory, tribe, or state, thinking about and always just asking the question, how are we addressing family child care compensation? How are we doing that? And a lot of people like to say, oh, that's just too hard. That's just too hard. We can't. Yes, we can. We can all do hard things. So I would challenge you to always just keep raising the question. And we might not have the answers right away, but if we continue to ask the questions, we're going to live on into the answers because we will always bring it to the conversation. It is just, it's easy to say, let's talk about that in the place where it's easiest to talk about it. And I invite you to start conversations about how to think about compensation from the places that are harder. And family child care is harder to just think about. It requires different kinds of thinking. So get your best pals together, the biggest thinkers inside of your system, and really make sure that family child care is part of the conversations around workforce compensation. The next point is think about opportunities for financing that are beyond materials and curriculum. They're great, they're fabulous, but they are not the major costs that are coming into family child care. It isn't, no one left the field saying, I would have stayed in it if someone had only bought me that teaching strategies subscription. That's not typically why they're not coming in or they're not staying. Look for ways to fund things that are not as tangible. And that is a hard thing. It requires trust. It requires rigorous systems. It requires thought behind how can we make a difference? How can we make meaningful impact? And curriculum and materials are wonderful, but we have to think beyond those line items to make sure that we are adequately capturing the things that draw people into our field and to stay in our field. One of the best ways to learn that is right now through the CCSG grants, the Child Care Stabilization Grants. As of this morning, 15 states had their applications open, and all of those application processes are designed differently than I've seen them ever before. It wasn't just a grant that local CCR&R was giving out for brand new cribs or to be compliant with a new policy. This is a different kind of application. And if your state, territory, or tribe asked different questions about financial information or maybe just who owns that business, it may be the first time that you have a robust data set of demographic information of family child care providers in your state, territory, or tribe. It may be the first time that you understand what they're spending money on as they ask for operating support and they allocate it to the different eligible categories. So anything that you can glean from the Child Care Stabilization Grant process will help you to do some big thinking about how to create responsive systems and responsive financing for the support that family child care entrepreneurs are looking for. And that leads me to the last point. And Erica has said it, and Patty has said it, and I think the other 3 sessions have said it. We really need to understand what makes family child care businesses sustainable financially, and avoid the temptation to only hear the complaints about regulation. there are valid complaints about regulation. I'm not saying that. What I am saying, though, is that the reason that people leave out early or stay in it for only 5 or 6 years or leave largely have to do with financial reasons rather than the regulation. And so there will be some people who leave because of regulation, but that's the easy answer. Start asking questions, asking for input, for feedback, for information from your family child care leaders in your state, territory, and tribe about what's the real deal? How are things actually hitting their program once it was a great idea and it went through all of the changes it needed to go through to meet the policy and practices standards of government? What did it actually look like when it got to the bottom line of businesses? And too often we hear it's cumbersome, it's out of reach, it feels like it's not designed for me, it isn't. They asked a bunch of child care center questions, and I'm not a child care center. Like, make sure that what you've designed is the right thing. And so it's the right fit, the right size. This all part of your design, but don't do it in a conference room over in a beautiful building for the Department of Human Services. That's not where the best ideas come from, and they're not the ones that are connected closely to the ground. So use that information to inform your decision making, and use real data, not just opinions. Really use real data about what childcare businesses are spending money on. Erica mentioned earlier what people are doing to survive the pandemic. And inside of our organization, we have data about the same kinds of activities. People are taking on credit card debt or high interest loans or sometimes predatory financing to keep the lights on. And so we really have to understand what their needs are and design interventions in our system that are meaningful and accessible to the folks that we want to take advantage of them.
And Heidi, I just wonder before you finish with ideas to consider, and then we take some questions if there are some, if we could just ask people in the chat, and if you might go back to the other slide, if we just ask people to put in the chat if during this time of truly unprecedented investment in childcare and family childcare, what innovative solutions have you all implemented for financing at the business level?
Yeah, share those in the chat. And so many of you are in the weeds on that work right now. You're designing what those administrative allocations are going to look like, how you're going to provide technical assistance that accompanies any of those childcare stabilization grants. Think about ways in which you can share the good work and the good thinking that you guys have already with the colleagues on this call. And if you haven't thought about it, include capital. There's a lot of capital in the market right now with the childcare stabilization grants and other grants. But think about what's going to happen when those eventually recede or they're used up. How do you create additional streams of capital that will be available to new providers who weren't open, who are going to open sometime next year and say, oh, sorry, too late, you missed all the good stuff. How do we create access to capital? And I think your system is designed to be able to do that. And capital can be grants, it can be forgivable loans, it can be traditional loans, there's lots of things. But there will always be a need for capital to be able to, in the marketplace for family childcare, to be able to get new businesses and to grow those businesses as they mature. I would also think about partnering with other state agencies to capture things like entrepreneurship funding or business funding, small business funding. There's a ton of funding that's directed to women or to Black, Indigenous, and people of color who are starting businesses. Childcare is a business. And so don't limit yourself to only the child care dollars. There may be other more flexible dollars available somewhere else inside of your territory, tribe, or state. And then think about ways to incentivize the kind of care that you need to be able to meet those needs. The last thing that I'm going to talk about, because I know we are getting to the end of our time, want to make sure that we have time for some questions. These are the takeaways. And so hopefully they make a little more sense to you now that you're seeing them again. But the most successful financing solutions at your system level or at your business level are multi-level. They address the diverse needs that childcare has across the spectrum. It also is that they are right-sized. Like giving a family child care business a $300,000 grant per month makes absolutely no sense. It is not the right size for the scale of their business. So make sure that you are creating opportunities that are going to be available in a variety of places, in a variety of geographies, and to make sure that the people who are leading family childcare or going to start up family childcare have the right kinds of tools available to them. Think about a balanced approach and really use that ecosystem as your guide. Of course, think about equitable solutions, and equity across provider types is the most important part of these conversations inside of your state, territory, and tribe. There are easy answers for childcare centers, for Head Start, and for school-based programs. You have to almost advocate for family childcare in those conversations to say, how do we bring a right-sized version of this to family childcare providers? How do we do this same thing with the right design behind it that is custom for family childcare? And so thinking about equity and right-sized and balanced, all of them sort of go together. And then finally, coordinated. It does us no good to have disjointed things inside of your seat of government, right? So if you're inside of a state agency and licensing doesn't know what the startup crew is doing, and the startup crew doesn't know what the Access Capital group is doing, like that does us all no good. Coordination and alignment and leveraging those opportunities inside of your system are paramount to the success of family childcare, fully taking advantage of all of the opportunities you are trying to design for them. That is the final slide that I have to share with you today. I'm going to stop sharing my screen, and Patty will take questions, or we can ask some other questions.
Heidi, that's great. And I'd like for folks, if you have additional questions or comments for Heidi, to put them in the chat. But I do have a question that I wonder if you would address while we're waiting. My mind usually is when I get to have a conversation with you, it just is spinning. So for the people who are on the phone, it is a lot to consider, and it is multifaceted. Where do they start, especially if they have decisions that they have to make in a very short amount of time? You're on mute. You put yourself on mute, Heidi.
Those darn Zoom practices. If you are inside of a system, a good place to start is to identify what you're paying for already. What are the CCR&Rs in your state doing? What are you investing through contracted relationships already? That will give you at least, you can sort of like line them up and say, where are we spending now? Is it balanced? Is it diverse? Or is it really heavily weighted in one particular area? You should also look to any of the kind of written materials about priorities or strategy that may exist for your tribe, territory, or state, and look for ways to sort of like feed the connection to the ecosystem, your system investments to get to that next place. And then start to just think big about what your biggest challenge is and say, why are we having that challenge? And make sure that you have the data to back up that idea so that when you are creating those investments, you have good reasoning around what is the problem you're trying to solve. A lot of times we jump to a solution without having done the work. And I know everyone is under the gun. There's never been a more stressful time to work in childcare systems ever. But as fast as you can, deploy those resources of the IT folks and the data folks and the analyst folks inside of your departments and agencies to help you search for the factors that may lead you to future success.
Great, thanks. And I know a lot of people on the phone are thinking about compensation and benefits for the workforce as a whole. What recommendations do you have for them specifically for the family child care community?
Yeah, if you don't understand how compensation currently works for family child care, that's a place to start, is making sure that you understand how family child care business models work and operate and what does compensation mean. So can you look at a statement of a family child care provider and what can you glean from that information? If they clear $25,000 a year, does that mean that that was their take-home pay? Like, make sure that you understand how they're currently operating, because you can't arrive at a solution to enhance that if you don't currently know how it's operating. So start there. If you're unfamiliar, get familiar, talk to the CCR&R folks in your community. If you are lucky enough to have business coaches and consultation, what data can they share with you, or learnings can they share with you to enhance your understanding about what's currently happening? And look beyond, look for business data where you can find it.
Thanks. And as hard as it is to believe, we have only 2 minutes left. So please, if you have a question, put it in the chat. But Erica, if you're still on with us, I'm not sure if you want to add anything before Heidi closes out.
Hi, Patty. No, Heidi, you did a great job of covering everything. And thank you so much for going into the detail around their compensation. The one other thing that I would add on there is also retirement planning is something that has been coming up for educators, and thinking about that on top of all the other expenses that they would get if they were working in another type of field. So thank you.
Thank you, Erica, and Heidi, thank you for sharing your expertise. And Sarah is going to turn over some evaluation questions, but before she does, I just want to make sure that you all know the resources that are available to you through the National Center. I put the link in the chat earlier and I'll add it again. And again, we're so grateful that both All Our Kin and First Children's Finance are partners with us. So if there's additional information or follow-up you'd like to do, please just reach out to us. And it would be extremely helpful for us to know really what resonated with you today and what recommendations that you have for future topics. So if you'd go ahead and pop that in the chat, that'd be great. Again, thank you, Heidi and Erica, and Sarah, I'll turn it over to you.
Thank you, Patty. I will go ahead and open up the polls. Let's see. And I think it says I'm logged in from another device. So I think maybe Tatiana, who's joined us through the Quality Center account as well, you might have the option to open the polls.
Able to see the questions on your end?
Oh, can you see the poll questions, Tatiana?
Yep,
I can, and I've just launched them.
Okay,
Just wanted
great.
to make sure everyone else is seeing them. I'm having a couple of people already answered.
And while folks are doing the poll, I'm also going to put another link in the chat box. for those of you who don't know, the TA centers have made available a good number of resources for accessing the stabilization grants. And there is a page for childcare providers and also a page for training and technical assistance providers working in states, territories, and tribes. So there are some resources there now, and additional ones will be added, those aimed for providers. So I want to make sure that you have information about those. First Children's Finance created budget guides for both childcare centers and one in particular for family childcare providers. So with that, if you would please complete the evaluation, and our final session is completed. And thank you all very much. And Erica, again, thank you. And Heidi, thank you for your wisdom and expertise.